Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
All right, welcome back, everyone. We've got something a little bit different for you today on a topic related to something we've talked about a lot, constipation, but we're going to specifically go into hemorrhoids and fissures.
Yep, very end of the tube today.
So, any pregnant woman who's pushed out a baby.
Oh boy. Otherworldly.
Yeah.
What happens down there, I wish stays down there. But we need to talk about it, people. We need to talk about what happens. And it's not just pregnant people.
No, but God, do they suffer?
Yep. Sure do.
These women. I had the foresight of resolving my hemorrhoids before I had to push out for 6 hours.
Yep.
I pushed my first one for 6 hours.
Yep.
Thank God for that. But if you don't, then you're dealing with all of the front of the pouch swelling and pain.
Yep.
But the back of the pouch, that is a different form of torture.
War zone.
War zone is right. I would agree with that. Hemorrhoids.
So we're covering this topic because it is important to a lot of people.
Yes.
And it happens quite a bit as a problem with a lot of the gut stuff that we talk about: diarrhea, constipation, all sorts of things.
So let's start with pregnancy is not the only thing that causes hemorrhoids.
Yep.
What else causes hemorrhoids?
Constipation, diarrhea.
People who sit too much.
Yep.
People who stand too much.
Yep.
People who walk too much. People who don't walk enough.
Yep.
Sedentary lifestyle.
Yep.
Over-exercising lifestyle.
Yep. Hypermobile tissues. Things just fall out.
Standing
prolapse.
Really?
That one is the one that actually took me by the most surprise when I learned about it.
Huh.
Yes, if you're on your feet like a
Totally.
teller at a bank or like a teller at a grocery store.
So you should just lay down.
We're supposed to be moving. We're supposed to be moving.
Yeah.
Just one position forever is not a good idea. Yep.
Yeah, I mean, yes.
Treadmill.
American toilets.
Oh, yes. Positional problems.
Yeah. I don't know whose idea that was.
I know. It's rough.
This is my story about when I was in China. Like, the worse the toilet smelled, the more American it was.
Oh, really?
For sure.
Yeah, because Chinese squat.
Yeah, we've talked about this before.
So when they hop on a toilet seat, they don't sit on the toilet, they squat on the toilet.
Yep.
So those toilets smell bad.
Way better to do that. Yep.
Way better to squat. Yeah.
Yep. So
men are at risk, women are at risk.
Yeah.
Children, not so much, but sometimes we have more constipation.
Yeah.
So sometimes children.
Atonic constipation is a thing in kids, and then things just pouch out. So, but tone is generally better. So what do we? Oh, and fissures.
Oh, fissures.
We're going to talk about that here too, because same part of the body.
Yeah.
But that rather than things popping out, the skin gets these cracks.
Usually constipation still, right? Like the bowel movements are not as regular.
I see a lot with my IBD.
Retained stool irritating the tissues, and then it just gets kind of friable and irritated.
Diarrhea.
Yep.
Also
because the mucous membranes slough off.
Yes.
Yep. So anyway, this stuff hurts. It bleeds. It predisposes you to infections. You get itchy.
Yeah.
Yep. And not fun. So
sometimes it's so bad you need to sit on a donut because it feels like you got a bunch of little
postpartum. Yeah, I had one of those donuts.
Yeah.
They help, but you don't want to live life like that. It's no fun.
We're talking about anatomy, right? The anatomy is you have more veins in your rectal plexus than you have anywhere else. So I imagine like the butthole, and then a bunch of netting. I mean, that's what. Yeah,
it's the topic. I mean, keep it together over there.
And then a bunch of netting that comes up from the rectum, right?
Yep.
Well, that netting, every time you see one of those ropes knots, that is a place where you can have an outpouching.
Yep.
That is exactly what happens. And in fact, that's one of the reasons why we give drugs, either orally or rectally
Yep.
is because of that rectal plexus.
Gets right into the blood flow.
Absorption.
Right into the bloodstream.
Yep.
And so every time you have irritation, straining, pushing, stagnation, you can have a loss of integrity of the vessels. And that is what a hemorrhoid is.
Yep. Things pop out.
Yep. And a fissure is just what Dr. Sand said. The tissue gets irritated and it cracks.
Yep.
And that crack, I know a crack seems like, oh, it's just a little crack.
Oh, it
But good Lord.
hurts.
Yeah.
It's like
Can take a long
glass.
time.
Like
to heal.
glass.
Yeah.
Yeah. It's like glass on your, it's like pepper or salt on your open wound.
Yeah.
Well, because you can't keep it, you can't like immobilize the area,
Yep.
you know?
Got to keep
So,
it flowing.
Yep.
Yeah.
And so we have options for standard of care. The options are usually actually surgical.
Ugh.
For fissures, you can use topical nitroglycerin.
We're
and
not there.
Okay.
We're going to get there. Uh,
Stop your good ideas.
we're going to get
I don't know the efficacy off the top of my head, but you can try things.
Yep.
few
You can
things.
try things. That's for sure.
So one thing that we forgot to talk about is there are different forms of hemorrhoids.
Yep.
There are external, there are mixed, and there are internal.
Yep.
External actually come out and you can feel them in the rectum.
And a lot of times you can pop them back in,
Yeah.
depending on, what's
If
going on.
If it's thrombosed, you can excise it.
Yep.
So there's thrombosed, which means it's like clotted, right?
Right.
That's
Yeah.
like, there is, and then there is mixed, which is like partially external, partially internal.
Yep.
And then there's internal. The internal is above the
Dentate.
the dentate line. Yeah. What's that sphincter? It's the internal hemorrhoids, internal rectal sphincter. So
Anal
it's,
sphincter.
yeah.
Yeah.
So it's above there. And then the external is below the internal rectal sphincter. So that is what happens. And then let's say you have hemorrhoids and they heal up, then you can have
Skin tags,
skin tags.
which get itchy and
Yeah.
irritated and infected and not
Yeah.
fun.
Yeah. And
Hard
so,
to clean.
For hemorrhoids, there's a couple of conventional treatments, like treatments that we can do in the office. And then there is times when you refer out to a surgeon.
Yep.
So for conventional treatments, there's topical analgesics, there's topical anti-inflammatories,
Yep.
there's like venoactive agents that, cause a decrease of the swelling of the veins.
A lot of it I see is just like you do pain stuff.
Yeah.
Until you cut it out. That's conventional, what I usually see. And then
increase fiber and hydration.
So the first thing
Hopefully.
anybody's going to talk about, conventional or
Right.
naturopathic
Yeah.
or functional medicine, is diet and lifestyle, right?
I mean, we have to. But on the surgical note, I've had so many patients who had surgical removal and it caused scarring and irritation where it keeps opening and getting infected. Like, I think it's a rough spot to take a scalpel to. If you need it, you need it. But we just have so many other things that we can do to support that part of the body
Yes.
that doesn't involve surgery.
Yes.
And I'm so cautious with my patients to send them for that. We have a lot of other stuff we can try.
Including like non-surgical
Yep.
interventions, which we'll
Yep.
talk about.
Yep.
So most common, increase your fiber,
Yep.
increase your water,
You got to
increase your
poop.
movement.
You got to poop. You got to
Yeah.
get things out. You got to decrease pressure. So again, squatty potty, people, move your body.
Move your body.
Yep.
Okay, from there, we have, if that doesn't work, if that's not enough to reverse, then, are we done with conventional stuff? The analgesics, the sitz baths.
Pretty
Sitz
much.
baths, I think, is both conventional and naturopathic.
Yeah.
Sitz baths are basically, you can soak your bottom in cold water or hot water to kind of relieve some of that pressure there.
You can add herbs to it.
You can add herbs to the sits bath, but that's going to be in our naturopathic section. And then honestly, in the conventional, like preparation H is an example of something you can get over the counter, or you can get topical steroids or analgesics. Yep. That's absolutely right. You just kind of deal with the pain until you cut it out. So that's conventional. There isn't a lot going on there. And then there's surgical conventional. And that, I kind of just want to tell you guys about some of the options, but really you want to leave that to the surgeon to decide. And so the patients and the surgeon can decide together, but you can like excise the hemorrhoidectomy. You can do an open versus a closed hemorrhoidectomy, or you can do a like
band ligation.
Band ligation. Yep.
Yep.
So there it is. That's conventional.
Okay, let's get into the fun stuff.
So galvanized current.
Yes.
Oh, is that what we would refer people
That
to?
is my
That's
favorite.
my favorite.
Okay.
That's my
Is
favorite.
there, did we ever look, I mean, it seemed to help people. I
It-
never
oh my
looked
God,
at
it saved me.
100%. All my pregnant folks, like I need everyone to know about this because it works so
Yeah,
well.
And this is only at the one office that we
No,
would
there's
send
a couple
everyone
of
to.
offices, but I'm pretty sure it's only in Portland, Oregon.
Yeah.
I mean, okay,
We are
this is a
so lucky
very-
we have it though.
When I was in New York, when I was practicing medicine in New York for that 9 months, not even a year,
But is it, sorry, go ahead.
I was like, that was who I missed. That referral
Totally.
was I missed that referral more than anybody else. So let's talk about this treatment.
But is it embarrassing to go to the office? Because that's all
So what I
you
tell
were fine.
what I tell my patients is 100% of my patients have come back and said it was a good experience. Most of them say it's awkward.
I have a couple.
That's what I was going to say.
But it's like the track record.
It's worth it. It's worth it.
Yeah, I tell people like we
You can
all
wear
know.
a mask.
Yeah, we all know what we're talking about. This is all they do, and most people are like,
Yes, this is the
solved
only
my
place we
problem.
refer people. So
Uh-huh.
I mean, I will also say, so when I was pregnant and I was getting my hemorrhoids treated
Yep.
before delivery,
Yep.
the doc who I was seeing was also equally as pregnant as I was.
Oh, really?
But she was up in my and everybody else's butt all day long.
Yep.
I was like, thank God I have my job and not her job.
Totally.
But that
totally.
being said, it's called the Keezy treatment, and it is using a low volt galvanic current
Mhm.
that basically like tautens or suctions up the vessel.
Yep.
It's non-surgical. It
Yep.
doesn't hurt.
Exactly.
Doesn't irritate.
Yep.
It's very benign.
I wonder why we don't use this more routinely in other circles.
Where's the money to study
But you
this?
can charge for the procedure at least.
No, I think they make good money.
Yeah.
But like, who would study this? Like, there's no incentive.
I mean, it
there's
seems
no
like a
incentive.
good thing to
Yeah.
offer.
Yeah.
I know. And you don't need anesthesia for it. Like
No.
It
you're
doesn't
in,
hurt
you're
or
out.
anything?
No.
It's
Wow.
like literally they're putting.
I've had
on.
multiple patients I sent and they reported back good, positive experience.
Yeah, my girlfriend is a labor delivery nurse.
Yeah.
And that's one of the things she sends all of her when she's like
Totally.
nursing through because it helps her so much.
Yep.
She was like, I think we give that clinic more referrals than anybody else. Like
Yeah.
every woman who delivers gets a little
That's-
card to that office.
Yep. Yep.
And it's
That's what I say.
life-changing.
That's
It's
great.
life-changing because
Yeah.
I'm sorry, when your bottom is on fire
Yep.
and you have no bandwidth because all you're thinking about is how your
I
bottom
know when
is
you're
on
trying to do your
fire.
job, you're trying to get in your car. I mean, it's
Well, especially if you have
rough.
to have a baby or,
And, plus you have a baby and then your
Yeah.
bottom's on fire.
So I'm surprised more of your guys' offices don't just have, it's probably a
They
machine, right?
They won't teach it.
Oh, really? Okay.
They won't teach it.
Okay. That's
Yeah,
fine
yeah.
then.
They
I
won't
was
teach
thinking,
it.
is
I
it
mean,
just a
they've
little
earned it.
machine
It's good
or
stuff.
Yeah,
Yeah.
it's a very old machine.
Yeah.
But they won't teach anybody. I mean,
Okay.
it's like they have such a corner on the market.
Right.
Yep.
And
Anyway.
so
They
effective.
should
That's
have one per
excellent.
state.
Yeah.
Yep.
So, okay. So there's the Keezy technique. And if you're curious, Google it, Keesey.
Yeah.
That is incredible.
Yeah.
That is honestly where I start and end most conversations. But some people don't live in state. Some people don't have access. And some people don't want somebody putting a wand in their butt or
They
an
wanna-
anoscope in their bottom.
They want to try other things first. And even with that, like, let's say we correct them. How do we prevent it? What else do we do to make sure this doesn't come right back? Because it got there for a reason in the first place.
So that's our prevention.
Yep.
But let's talk about topical agents. Like,
Okay.
what do we have topically? Because that's the other thing that I use a whole lot of.
Yep.
What do we have topically for hemorrhoids?
Witch hazel.
Witch hazel is fantastic.
Yep.
That is something you can get anywhere you want.
Cleaning. Yeah, they
Yep.
make pads with it that you can use to wipe the
You can
area.
also, soak a cotton ball.
Yep.
And put it topically over the rectum.
Yep.
That does work, and it also tautens.
I have folks consider getting a bidet attachment.
Mm-hmm. Just to clean it up.
To clean it up, but also to reduce the tugging, because wiping with paper that's
Yeah.
dry.
That does sound very uncomfortable. Now that I mean, I wipe my butt all the time. But now I feel
You still
uncomfortable.
don't
I'm glad
have
to hear that.
bidets?
I'm not gonna get it. I know. I mean,
What life are you living?
I was trying to convince.
Are you even living is the question?
Clearly.
I had to sit on a cold toilet at a hotel.
Oh.
And it was like a shock to the system.
You
It
are
was
roughing
cold.
it.
I have a heated seat at home with the bidet, so I was like, "What is going on here?"
I tried to convince.
That's why I try not to leave home.
Yeah.
With me, I was at a conference, and I was like, "Just come. There's a bidet. It's like they made this toilet for you." I guess
Oh,
it's
that
not
was
here.
another cold toilet weekend.
Yeah.
It was freezing in the snowstorm, and the heat went out.
Yeah.
That was not a good
And I was
toilet morning
in
either.
Hawaii with my bidet warm toilet.
Oh boy.
Okay, so there's absolutely witch hazel. There are other plants that I have noticed work really well. Horse chestnut.
Yep.
Horse chestnut is one that we will give orally and rectally.
Yep.
That is another one of those that it's not only used for hemorrhoids, it's also used for varicose veins.
Uh-huh.
But it
Yeah.
just tautens up it supports the vasculature.
Totally.
And you have more vasculature in your rectum than anywhere else.
You sure do. So on that note, berries as well.
Berries, anthocyanins.
Yep. For vein health.
Any berries with color.
Yep.
I feel like there's a commercial horse chestnut suppository that a patient had used. Does that sound familiar?
That would make good sense.
Okay.
That's great.
Other plants that I have actually worked a lot with, which I'll make into a suppository form, are stone root, butcher's broom, mullein, and St. John's wort.
Huh.
Do you have to make that, or is that available?
Unfortunately, I do have to make it.
Okay.
Wow. What about aloe?
I've never used it topically.
I like aloe. It's like cooling and soothing, and then I like the antimicrobials in it.
Yeah.
Orally or rectally?
No, rectally.
How do you prepare it?
I don't make it. Someone makes it. They make a ton of herbal suppositories on the market.
Okay, so people can buy it.
Yeah, yeah. But I like the ones that have the antimicrobials in it because bacteria brew in there. It's hard to clean when there are out pouchings and in pouchings and all sorts of stuff.
Bacteria brewing is coming up a lot in our episodes. Yeah. I just cannot get that thought in my head about that witch just in the rectum brewing an infection. Now you guys, if you guys are wondering, that's the thought for you.
Yep. So clean it out, keep the bacteria load down. Things are going to heal faster.
And by the way, keeping the bacteria low down, washing it is definitely the best way to do it for the day.
We already covered that.
The other thing is, I have a surgeon that I really like to refer to. Let's say you stall out of everything and now you need surgery. I have a great colorectal surgeon in town that I really, really like that I refer to. And he is always telling people it's too clean. Like, you also don't want to be using wipes.
Wet wipes.
Don't use wipes. Yep. Yeah.
I mean, that is, I feel like, can we talk about
But if you have a bidet, then you don't need the wipes.
Yes. But
exactly.
Can we have a PSA conversation, like a real PSA conversation?
Yep.
Because I don't think you guys are understanding how many people are baby wiping their bottom.
I know.
Really?
Yes.
I just have them wet the toilet paper if they don't have
and you got to dab. If you do need water or something, you got to dab. You can't wipe because you remove all the mucosa that you need. It dries it out. Tissue's thin.
I mean, when someone explained to me, we would never use like a abrasive paper towel to like wipe our hand. Like we don't even use that to wipe our hands, you know? Like why would you use that to wipe
so delicate
sensitive tissue?
I know.
Whoever came up with the toilet paper is really...
They were Americans, I'm sure. The other thing is, with getting back to, because I know multiple of my cousins back east are using baby wipes to wipe their bottoms. Like they're not using toilet paper.
And then they're flushing them?
I mean...
And they're not getting sewer backup?
Oh, I'm sure they're going to get sewer backup. Let's be honest.
That is a problem.
But here's the thing. The other thing that baby wipe does is it does change the microbiome.
Totally.
We talk about biofilms. We've done biofilm episodes. We want a lot of diversity there.
Yeah.
Like you do not want to sterilize.
They're using antimicrobial wipes.
Yes.
Yeah, that sounds horrible.
It's just not a good idea. That area should not be that clean.
I bet that hurts. Doesn't that hurt?
I mean, now it's their normal.
Oh.
And they're like, it's dirty. If I don't clean it with an antimicrobial baby wipe, it's dirty.
They have to wean themselves off.
I mean, it's bad. So PSA, guys.
Don't
PSA,
do that.
Don't use baby wipes to wipe your butt.
Bidets.
Use a spray bottle. Use
or
toilet
just
paper.
You can moisten the toilet paper with water.
Yep.
Don't use
you don't
bidets.
have other.
Yeah.
So that is I will oftentimes, if patients are I used to have a source where they would make me my suppositories for me, but then, that person moved on.
Yep.
And so if patients are wanting to get crafty, I will have them put together a 1-to-1 herbal formulation with a coconut oil base and a little bit of vitamin E that has all the calendula, the yarrow, the mullein, the stone root, the butcher's broom, and the horse chestnut and witch hazel.
Yep.
From tinctures?
No, usually from plants.
Tincture would hurt.
Yeah, and I usually have them slow cook. So like they'll use like an Instant Pot or something or a crock pot on low.
So you've got them like on leave to make these.
I mean, I wish. Like it was great when I had let's be honest, I had a naturopathic student making it for me, but then they moved on.
Gotcha.
Because it's a process, but it's a very effective process.
Yep.
So that is hemorrhoids.
Yeah.
Anything else for hemorrhoids before we touch on fissures?
Well, can we talk about prevention yet?
No, let's talk about treatment first.
Okay.
Prevention is last.
We're all getting in trouble with you today.
I'm keeping us on task, guys. Okay, let's do a quick conversation about fissures, because fissures also suck.
Yes. Yes.
I have a couple of tricks up my sleeve that work really well for fissures, but I have many people that I stall out at that do need a fissurectomy, which is a surgical procedure, which sucks. So I try to do all of my things before.
Totally.
So the hygiene stuff, the other stuff that I'm playing around with, and this is, I want to just really thank.
Can I say one thing?
Uh-huh.
Okay, just make sure someone has done an exam, because I'll have patients come in and say they have hemorrhoids, and they don't have hemorrhoids. They have a fissure.
Yeah.
So it's always awkward, but someone needs to do an exam. Don't just assume that it's a hemorrhoid because they say they've had hemorrhoids for years.
And you're
right?
saying like an anoscope or just an external?
I mean, you can do just the office anoscopy, but even if you look externally, you can usually see a fissure. You might not see the hemorrhoid unless it's an external hemorrhoid.
And to anyone who forgot this from school, if you're doing an anoscope, hold it in.
Oh, word. That is a strong little muscle right there.
Hold that scope tight in, because it will fly across the room.
That is a very
you mean point. Like when you're carrying it?
No.
When you're inserting it, you have lube around it, you're putting it in, and it doesn't hold itself in there.
Oh, I see.
It will shoot out across because that is a tight sphincter. And it should be. It should be, but you gotta...
Because I feel like with a vaginal speculum, it's staying in there.
It stays in there. It did not happen to me, but it happened to a friend of mine, and it's just an image I will never forget because it was unpleasant for everyone involved.
Sure. One of my first experiences as a medical student, I was in the ER with this attending, and I was holding the anoscope, and I didn't realize how you had to hold it.
Yeah.
And I dropped it not once, but I dropped the second one as well. And then finally I was like, I'm so sorry. I finally realized how you have to hold it so it doesn't fall apart, because we would... Yeah. It was the third time. Very nice doctor, but it was very embarrassing.
That poor patient. Can we give a moment of silence?
Yeah.
Okay. Anyway.
Oh, it's hard out there.
Okay, so let me tell you what my go-to is for fissures.
Okay.
My go-to for fissures is I really, really love the high-dose vitamin E oil. Vitamin E is very, very healing for the tissue. I have just recently...
Are you having people put caps up, or what are you...
topical?
If I can get an oil, for a fissure, it's usually on the outside,
you
know? And so there used to be a great oil by now, which I have a hard time finding. It was 54,600 IUs per mil.
Yep.
It's crazy, super powered vitamin E. So I would use that one. If not, I'll open up a vitamin E gel tab to apply it topically. And just recently, thanks to one of my favorite patients, we've been playing around using sodium butyrate.
Huh.
So phosphatidylcholine, basically, sodium butyrate. And we're making a mixture, by we, I mean she is making a mixture of sodium butyrate and vitamin E that she is applying topically to her rectum. And it is really significantly improving her fissures.
Cool.
And so I just started, I think maybe I have like 5 or 6 patients that I just started playing around with that. Sodium butyrate is one that I go through deep up and downs with, because I use it all the time for UC and I didn't get anywhere, so I just stopped using it completely. And now I'm like, okay, I think there's a sweet spot for it, but it's not what I thought it was.
Yep.
And so sodium butyrate has now become one of my favorites for fissures.
Cool.
Yep. And then, somewhere between 1 to 2 grams of sodium butyrate, depending on the severity, a couple times a day.
Great.
So, okay, I'm done with treatments. Anybody have any treatments before we jump into prevention?
I mean, there are the conventional, right? Like the calcium channel blocker compounded topically, or the nitroglycerin topically, but I don't know the efficacy on those. I don't think it's amazing, but it's something.
Yeah, and you can compound those, like all our local compounding pharmacies. You can compound those with herbs and whatnot, and lidocaine if you need it.
Well, compounding pharmacies aren't allowed to do herbs anymore.
Yeah. And you can use a low-dose topical steroid, for symptomatic treatment while you're doing all the other stuff.
Yep. Calm it down. Yeah. Okay. Prevention? Oh, finally. Okay. Psyllium husk nose. Although it is considering, but get the bowels moving. So if people are constipated, like obviously magnesium citrate's great. Tell people not to strain. And then this is a callback to our constipation episodes. Instruct people how to breathe when they're pooping.
That's a big one.
Breathe while you're pooping, people. Breathe out. And then breathe in, and then breathe out.
Yes.
We all, for whatever reason, people hold their breath when they're pooping. I don't know why, but it's not good for your pelvic floor.
Or any other part of you.
Exercise is important. Don't stand or sit for too long. If you have to, take breaks. Move your body. Eat fiber. Drink water.
These are sounding very reminiscent.
To every other episode.
Yeah,
I feel like I was good with my standing desk and my dictation, and now I think I need a treadmill desk too.
I feel like, are you ever going to be able to type anything on your treadmill desk? That's my
dictating.
Oh.
I got a headset. This was about, my usual 20 hours of research in. I figured out how to get a noise canceling headset that's compatible with Dragon dictation.
What about a rowing desk?
How would you do anything?
Rowing. I hate rowing.
But it's so good for you.
I know. I hate it.
I hate it too.
I did my orange therapy class that I did this morning. Rowing, a third of it was rowing, and I was like, oh, I hate rowing. Like, but for 20 minutes, I hate rowing. I hate rowing
too. I know.
My girlfriend tells me I'm just doing it wrong, and I'll like it if I have better form.
Huh. Well, report back, because I know it's good for you, and I need some strength really good in my life.
Do you have a rowing machine?
No, I don't. Have you seen me?
When are you going to do a
rowing? My arms are twins.
How are you going to access the rowing machine?
I just think about it.
I've been known to purchase exercise equipment that I don't use, so I'm just...
If you want more, we have some in the backyard.
I'm like, did I have them with your bike? I had them with somebody's.
No, I gave you your bike back. We just got someone to take the elliptical, so now I'm free again.
Until the next time.
We're trying to get someone to take our elliptical.
You have an elliptical?
Yeah, I know. Shocker, but we look like we work out a lot in this household, but we don't. Anyway, it is good to do that for hemorrhoids and fissures. Move your body, prevent stagnation. We all need that. Any other thoughts, tidbits, ideas out there?
I think that's about it.
Yeah, that was pretty good. I will say for fissures, the same suppositories, the herbal ones that I use for hemorrhoids, I use for those too and get good traction. The same herbs to kind of help heal, astringe, like clear out bacteria. Not a bad idea. Donuts if you need them.
Should we do a quick recap? That was a little bit of a recap.
Yeah, let's do acute and prevention.
Okay, so acute conventional, you're looking at steroids, topical analgesics, vasoconstrictors,
pain. Yeah, you said that.
Sitz baths,
cutting them out.
Yeah, surgical options.
Yep, surgical options. Naturopathic, you're looking at the healing herbs that are topically used. You're looking at the low galvanic currents if you have it available in your area. You're looking at the prevention piece. Fissures, you're maybe thinking about sodium butyrate and vitamin E.
Mm-hmm. Move the bowels, move your body.
Yeah.
Drink water.
Good.
Yep.
All right. Thanks, Turds.
Bye.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.